Good afternoon. Welcome to United TV. Today is August 9th, 2024. This is our wellness webinar day from United Medical ACO. We have two panelists, Caroline Weber as usual, and also we're going to have Amanda Bostick, one of our nurse practitioners. She's going to be with me. I'm going to ask them to join me. All right. Good afternoon, everyone. So if we can do a quick intro before we start. Caroline, we can start with you.
Hi, I'm Caroline Weber. I'm one of the dietitians on staff United Medical. Also take part in helping to run the diabetes program and run the diabetes wellness webinars.
And I'm Amanda Bostick. I'm a family nurse practitioner. I work for United Medical Associates, and I am at the Bear location as well as the Wilmington location.
Stop being your name. So, all right, it's better. Okay, so today we are gonna talk about, again, diabetes, which what we do in these sessions mostly, and usually we kind of go with the different comorbidities, different illnesses that goes with diabetes and how we can control. But today we are going to actually take a step back and introduce what happens when someone is diagnosed with diabetes. So Amanda is going to help us to better understand from the clinical side, and Caroline is going to help us with the nutrition side of the management of diabetes.
Mm-hmm. All right.
Okay, so thank you for giving me this opportunity to talk about what I do on a pretty regular basis at work. So I have diabetes, now what? So this is what a typical first visit would look like with diabetes. Next slide, please. So, just to start off with a few statistics here. Now, these statistics are from 2022. That was the last time that they were captured. So hopefully we'll have some new data the next time I present. But approximately 38 million people 18 or older have the diagnosis of diabetes. And I think what's more kind of upsetting is that a lot of people are walking around undiagnosed. So about almost 9 million adults over 18 are undiagnosed with diabetes. And then pre-diabetes, which I'll kind of get into in a couple of slides here, there's almost 100 million adults that had pre-diabetes. Next slide, please. So to just kind of talk about the different kinds of diabetes or types of diabetes that people have, because often I think this is one of the first questions is, what type do I have? So type 1 is pretty rare, and that usually happens in children. However, it can happen in adulthood. It's typically an autoimmune response where the body actually attacks the cells that produce insulin in the pancreas. So you cannot live without insulin. Insulin is the catalyst that brings the sugar from the bloodstream to the cell, so that it's like a key that opens up and provides the sugar into the cell of the body. So type 1 will always need insulin. Type 2 is an insulin resistance type diabetes. And that is where there's more blood sugar, there's more sugar in the blood, and the cell has then, the receptors on it have become resistant to the insulin that you already have and all of the sugar. Pre-diabetes is kind of this window where we can hopefully capture people before they go into the range of diabetes. So pre-diabetes is just probably some of this insulin resistance is happening, but your blood sugar is typically, we measure it by either your fasting blood sugar or your hemoglobin A1C. If your fasting blood sugar is between 100 to 125, that puts you in the pre-diabetic range. A hemoglobin A1C of 5.7 to 6.4 is pre-diabetes. A non-diabetic, just to kind of frame it all, is a hemoglobin A1C of about 4.5 to 5.5. Diabetes is technically, we've kind of gone over that threshold of the pre-diabetes, and a random blood sugar could be 200 or more. A hemoglobin A1C is greater than 6.5. And those fasting blood sugars are 126 or above. So your clinician, when you come in for that first visit, may want some additional testing. Maybe you didn't get all of that testing done, and maybe you just had an elevated blood sugar. So some additional testing may have to happen before that actual first diagnosis of diabetes. Next slide, please. So some things that can complicate diabetes, the way I think about diabetes is the sugar molecule in the bloodstream isn't like a soft, fluffy cloud. It's actually a rather large molecule, and it's kind of spiky. So it causes, you can think about these big spiky molecules kind of working its way through your vascular system, how that could cause some inflammation. So some things that can actually that can actually not make the diabetes worse, but just compound the damage that it's doing inside of your vascular system would be untreated hypertension, certainly smoking, yet another compelling reason to quit smoking, elevated cholesterol, physical inactivity, and then having a larger BMI or a higher BMI. So some of these things we can control, right? So like smoking, we have you quit smoking. Hypertension, we do our best to try to get those numbers tightly controlled. Same with the cholesterol, and then get you a little bit more physically active. And hopefully with all of those, we'll see a decrease in the BMI. Next slide. So the goals when I'm meeting with a pre-diabetic patient or even a newly diagnosed diabetic, is that I really want to get that person moving. What we know is that the big muscles of our body actually don't need insulin to just pull the sugar out of our bloodstream. So if I could write a script for, the first thing on the list besides, medication would be get moving. The more that you can move, and really looking at like moving throughout the day. So not sitting at a desk job all day and then going to the gym for 30 minutes. Really, I want to see some movement throughout the day, where, maybe after breakfast, after lunch, after dinner, you're getting moving. And again, like letting your body just naturally, your muscles just naturally decrease that blood sugar. Obviously, like I had said before, we're going to try to manage the things that we can with medications. So if you weren't on medication before for blood pressure or cholesterol, because maybe you were just borderline, this definitely puts you in the category. Once you have diabetes, we really want to get those numbers under control. Some vaccines that right out of the gate, if you're diabetic, we want to make sure that that your hepatitis B vaccine is up to date. Well, either if we don't have documentation of that, we can draw titers and look at that through blood work and decide whether or not you need that. We want to definitely get that tetanus shot up to date. And then if you're eligible, to also get you a pneumonia shot, because having diabetes does put you higher risk of contracting these other diseases. And of course, we would love for your COVID shot to be up to date. when I'm treating diabetes, the goal is to have that hemoglobin A1C. And the hemoglobin A1C looks at your sugar over the course of the last 3 months. So what we want to do is monitor that pretty closely every 3 to 4 months, and make sure that that's 7 or below. Ideally, if it's feasible, I want to get it as close to like 6.5 as I can, because then I know that some of these complications, we're going to reduce your risk there. And then certainly, if we can work on some weight management strategies here. But if you are doing the physical activity and changing your nutrition, I'm sure that those things are going to kind of happen naturally. So then that's where we start bringing in more team members and bringing in my diabetic team to help my patients. Next slide, please. And so some of the first medications that we're going to use to treat diabetes, first line is typically metformin. And very recently, I was reading some articles by the American Diabetes Association, where they're actually, even when you're in the pre-diabetic range, encouraging clinicians to actually start metformin a little bit earlier. Metformin is a medication that helps to reduce your weight a little bit, and it also keeps the liver from producing additional sugar. So it will naturally just help to bring down those sugars. And in some cases, I've seen it really help with some of this insulin resistance in my patients. And then I'm sure we've all heard on the news about the GLP-1 medications. So that's going to be your Ozempic and then the GLP-1 and the GIP, which is Mounjaro. There are a couple of other medications out on the market with different names. The way that those medications work is that they send a message to the brain that you're full. It also slows down how quickly you digest food. And then it looks like it also works on the pancreas with helping it to release insulin. So all of that in combination, that we've seen a lot of weight loss with that. So some of the other uses for that is weight loss. Obviously, the lifestyle changes of increasing activity and then your nutrition component there. And depending on how high that blood sugar, that initial blood sugar or hemoglobin A1C is, I will often start folks on insulin in the office at the first time. But again, if we're just in the pre-diabetic, or if we've got a lower hemoglobin A1C, we don't need to go immediately to the long-acting insulin. Next slide, please. So part of my team that I like to bring in is we're going to need an eye doctor to do an annual dilated eye exam to make sure that the back of the eye is healthy and that the blood flow to the eye is healthy. Again, think about those big sugar molecules and what they can do to the body. So again, those bigger molecules, they're going to really destroy some of our smaller blood vessels. So we really want to keep a close watch on those blood sugars and a close watch on those on the eye. Want to get you in with your dentist on a regular basis. Podiatry, we pull in podiatry because one of the complications that can come with diabetes is a loss of sensation in your feet. Called neuropathy is the medical term for that, but it can be like a tingling sensation in the feet, or in some cases, in more severe cases, a loss of sensation in the feet. So bringing in podiatry, they're going to do an excellent foot exam and make sure that your feet are healthy. And you would go at least annually for that. Of course, get you in with a registered dietitian, who's next on the agenda here. bring in an endocrinologist. Sometimes if we're having trouble getting that hemoglobin A1C under control, sometimes I'll bring in the endocrinologist. A nephrologist is a kidney doctor. And so oftentimes with diabetes, one of the mechanisms in our body is that if our blood sugar reaches a certain threshold, our body tries to spill that or take that sugar out of our bloodstream and put it in our urine to try to offload it, to try to get and correct our blood sugar. And you can imagine that those large molecules can be very damaging to the kidney. So we're going to be keeping a close eye on those kidneys. And then if we need a referral to a nephrologist, that would be something to consider, as well as a cardiologist. You've heard me talk about the cardiovascular implications with having diabetes. And again, if we see that there's a need to get you to a cardiologist because of diabetes, that might also be an excellent person to bring in. Next slide, please.
I think that is the last slide.
Okay. All right. Well,
Awesome.
Thank you very much.
And to tag along, we were talking about the team approach. We're going to talk about introduction to nutrition counseling, which is one of the steps in referrals that, especially if you're newly diagnosed with pre-diabetes, diabetes, working on weight management, we want to get you in to see one of us. There are 5 total dietitians, and we're here to help. So what can you expect from nutrition counseling? Who are we? What do we do? First step, I always love to say, we're not the food police. I had someone tell me today, I was so scared to see you. I thought you were going to be the food police and tell me all the bad things I shouldn't be eating. That is not our job. So we're going to kind of break down what a registered dietitian is, what we do, and what to expect from counseling. So what is a registered dietitian, or you might see our credentials, RD? We're a trained expert in nutrition and dietetics. Nutrition is a science. There's a very heavy background in metabolism, and it's specifically individualized to each person. Each person's metabolism is different. Your health needs are different. You are composed of all these different things, comorbidities, lifestyle habits, history, genetic components. So we want to work with individuals on their specific plan. There's no one size fits all. We're the only health professionals who are qualified and credentialed to give evidence-based individualized nutrition recommendations. So we come from a heavy metabolism background, extensive training, to make sure that we give you the most factual information about metabolic nutrition advice. We're credentialed, and that credential means a professional qualification, like you see with a nurse practitioner, an MD, a doctor, right? For those, it lets them, for other people, it lets us know that dietitians are educators, advocates, support for clients, their nutrition journey, but also we're a trained expert in our field too. Education requirements, all of us have at least 4 years of undergraduate training, and I have to do 1 year of hands-on training during an internship for about 1,200 hours or more of supervised practice. So kind of like nursing does their rounds and their rotations. We do this after we graduate. And we have to do this in order to sit for our board exam. Once you take the board exam, you get your credential as an RD. And in 2024, it is now mandatory that you get a master's in order to sit for your board as well. Each 5-year cycle, we have to complete 75 continuing education credits, and especially licensure, which is our next point. We have to keep continuing education credits for licensure in our specific state as well. Most states require us to have a license to practice, especially Delaware. So you'll see that tag at the end of our credentials, LDN, Licensed Dietitian Nutritionist. And it was put in place to protect our credentials and our name by ensuring that you get a qualified professional to practice in that state. So that's important that you look for someone licensed in your state to practice. There's a difference between nutritionist and registered dietitian. Nutritionist is less clearly defined. It could be someone who's worked for years with a PhD or master's in nutrition science. It could also be someone who's earned a certificate at a weekend conference. So it's not very regulated. But you have the credential of RD dietitian, registered dietitian, or even you might see RDN. RDN's kind of new. The academy put it in place just so we're recognized as a registered dietitian nutritionist, because nutritionist is more of a recognized term. But it's interchangeable. You could use either one. But you also might see some other credentials behind some of our names, right? There are certified diabetes educators. There are eating disorder specialists, right? Little niches that dietitians are interested in, that they want to get certification, sit for an exam. And usually when you do have an extra credential like that, you will have continuing education credits that you have to keep up with in order to maintain that credential. So now we know what a dietitian is, but when do you see a dietitian? Answer is anytime. You can see us anytime you want, especially after a specific diagnosis like diabetes, PCOS, kidney disease, heart disease, or even if you just had a condition for a long period of time and you want more information, we're here to help. If you're having trouble regulating blood sugar, you want to change a pattern of eating, you don't know where to start. If you're having relationship problems with food, right? You're having some unhealthy thoughts surrounding food, some habits you want to change. We're here to support that as well. Allergies, sensitivities, digestive complaints, you name it, anything surrounding food, we're here to support you on. If you're just curious about how to nourish yourself well, it's time to see an RD. There's no time that's too late to see one of us. We're always happy to talk about any and all things food related. And then how do you prepare for your appointment? So a lot of people are nervous going in. Like I mentioned that patient today who was like, I was nervous to see you. I didn't know what to expect. Here's what you can do. You can log for 3 days prior to your appointment of activity and food intake. It doesn't have to be crazy specific. If you forget to, we'll just ask you for, an estimation on what your average day looks like. But this food recall gives us more information, kind of where we're starting. What we can make changes on, what we can see as your schedule, your interests, and it helps us make specific goals tailored to you. Bringing any questions you'd like to address. If you have questions on food, diet, things you've heard or read online, there's a lot of misinformation out there. We love when people come with questions and intention of finding out, factual information. And bringing a list of any supplements and medications you're currently taking is also important. Because we have usually a shared medical record that's electronic that we can view, we know most of the kind of lab work that's been done recently. Usually pretty recent medication we know, but supplements, because supplements aren't usually regulated by the FDA, most times are not prescribed at times. So we want to make sure we know supplements because those can interact with medications, they can interact with food, things that you're eating. So that's important that you bring those to your appointment. And also if you have priorities and goals that you'd like to achieve, we're working for you, right? We're working with you. So we want to know what is important to you, where we want to start on our journey together. It's not our place to dictate what you're eating or assign you goals, but instead we want to educate. We want to work together with you to create goals that interest you, because if you have a motivation and an interest behind the goals, they're more likely to be successful. So what to expect during the appointment. We do an introduction, right? We get to know any and all things food history, emotional history surrounding food, eating disorder past, right? Family relationships with food, all those things affect the way we eat. We talk about what eating means to you, right? Eating is way more than just fuel. It's emotion, it's cultural, it's memory, it's all these different components that create our relationship around food. So we want to take that into account too. We'll do our assessment. We'll collect the medication history, your allergies. We'll do estimated nutrition needs if we need to, identify possible diagnoses. The diagnoses aren't medical diagnoses, but it guides our goal creation method and when we're seeing you. So when we form a goal, we create educational support, right? We work together to create SMART goals. We've talked about it in the past: specific, measurable, attainable, time specific, increasing our likelihood for success on that goal. We want it to be towards your preferences, right? If you don't like to run, we're not going to tell you to run 2 miles a day. We'll talk about what is enjoyable to you. What foods do you really love? How can we incorporate them to your diabetes management in a safe way? And keep in mind that we're not here to create, individualized meal plans for everybody. I wish we could. There's just not enough time in the day, but we create techniques and tools to help you create a meal plan that works well for you, right? There's no 100% perfect way to eat, but we want to set you up with tools and examples to guide you on the path of making some better healthy food choices to support your health goals. And then we schedule a follow-up, right? It differs on every person. Usually it can range anywhere from 1 to 3 to 6 months. Usually in the first follow-up, we'll do probably a 1 to 3 month follow-up, depending on what's good for you. We're accountability partners as well. I have some patients who like to see me monthly, some patients who just want to check in every 3 months after that new blood work or blood sugar has been taken, so we can kind of see if our goals have been working. Some people, once we get under control, those blood sugars are stable, we'll stretch it out to 6 months, check it in. Some people a year, but usually we stay within that 3 to 6 month period. And then how can working with an RD help your diabetes management? This is huge, right? Anybody who has diabetes should probably be seeing a dietitian, even if it's just to check in to see how your food intake's going. If you have any questions, blood sugar management, it helps decrease the stress and anxiety surrounding food and sugar management. A lot of patients come in super stressed, especially with a new diagnosis. What do I eat? Tell me the things I shouldn't eat, right? We want to say that all foods fit. We want to help create and teach skills to incorporate all foods in a safe, non-stressful way, because stress increases the blood sugar. And we want to balance it. We want to balance our food choices in a way that give us healthy blood sugar results. We'll provide education regarding the food's impact of your blood sugar, identify behavior changes that can improve blood sugar stability, like individualized plans of care for your specific nutrition needs, right? Maybe you need more water, more sleep. We'll talk about all the impacts that our lifestyle habits have on our blood sugar levels. But we're also a resource for questions, right? Surrounding food, eating patterns. There's crazy diets that we've talked about in the past that are online. If you do a quick Google search, you'll probably find 1,800 of them. We're here to kind of get rid of the myths and things and talk about, the basics, right? What is important for your blood sugar management, your weight management, any kind of goal that you do have set in mind. And we want to see you pretty often, right? That accountability. Oh, I'm going to meet with my dietitian. We're here to support each other, right? Through your habits, your journey. Because we want to see success and as much as you do, right? We want you to feel comfortable coming to us, asking questions, getting factual information so that you feel confident in pursuing your goals. And then how to get scheduled with one of us. We make it really easy. First, check your insurance benefits. We want to make sure that your insurance, is going to cover it. Talk with your physician about a referral, right? If you're referred to us from our network, right, you can see any of us. There's 5 of us, usually with all arrays of different schedules, so we can get you in pretty much anywhere. If you see the number listed below, the 365-8333, that's our scheduling department and care coordination. You can give them a call if you have questions, concerns, want to see us, but don't know where to start. They can walk you through scheduling, no problem. But we do want to see you. We want to see you in for a virtual telehealth visit to talk about where we're starting, what your goals are, how we can help improve diabetes or any of your health concerns. But we know that prediabetes and diabetes diagnosis can be overwhelming. So we're here to help. We want to be a part of your healthcare team. Just like Amanda said, it takes a team. We want to walk alongside of you during your journey too. So thank you very much.
All right, thank you. And Amanda, you can join us again. Thank you, guys. So a lot of useful information. Now, diabetes is one of the most common illness and disease in the United States and in the world. Actually, it's not just for us. If it's diagnosed earlier, there are a lot of good treatment options. Now, someone who's doing their physical wellness once a year, they should be getting a full blood work, even if they don't have diabetes, so that it can be actually diagnosed early on. The problem, I see it even on our bariatric side, patients with 12, 11 A1C, and their first time finding out that they have diabetes. And when it comes to that, then we know that something that could be very simple and taken care of early on, now it's more complicated. You have to be on several different medications. So we want to emphasize that this can be an easy management if we can get early on and start working with the patients. But it can be also extremely severe, especially with other problems, other illnesses. Chronic kidney failure, hypertension, other cardiovascular disease. These are all different problems that we see patients with diabetes, morbid obesity. So something that can be very, again, simple, shouldn't be complicated. So please make sure that you follow up with your primary care And if you do, one of the really important point that I want to make for our patients is that take advantage of our nutritionists. So this program has 5 nutritionists, dietitians. Not every program has those resources available. And in my opinion, they can make a huge impact on the management and better understanding of what we should be eating and what we shouldn't be eating, when we should be eating, and also checking with someone who's an expert on these. That also helps us a lot to manage these problems. Hopefully, we can help those who are looking for more help and better help, and we are here. Anything you guys would like to add?
No, that's good for me.
No, sounds good.
Okay, well, I thank you for both for being with us, and we'll be back again today. Actually, we have 2 other sessions. One will be starting in 5 minutes, and the other one will start at 3 p.m. with Dr. Erkan.